Ms. Ling.
Mr. Speaker, the HACSA Amendment Bill introduces a slew of changes aimed at better regulating healthcare services and providing greater transparency in their advertising to safeguard public interest in an environment of changing population health needs as our population ages. I will focus my speech on two of the proposed changes to seek some clarifications on: one, the introduction of an approval framework for service delivery modes and specified services, and two, the regulations on the advertisement of non-licensable healthcare services under the Act. First, approval for the provision of licensable healthcare services. New sections 11A, 11B, 11C, 11D give wide-ranging power and responsibilities to the Director General of Health, currently called the Director of Medical Services, in granting an approval for any permanent premises, conveyance, or other services delivery mode, which I understand can include telehealth for licensable healthcare services of a licensee. Under Section 3 of HACSA, health services definition is very broad and can range from, I quote, assessment, diagnosis, treatment, prevention, or elevation of any ailment, a condition, disability, disease, disorder, or an injury affecting any part of the human body or mind, nursing or rehabilitation care of an individual suffering from an ailment, a condition, disability, disorder, or an injury, assessment of the health of an individual, unquote. Well, I understand that this new Section 11 is an extension to the replacement to the previous Private Hospitals and Medical Clinics Act that is more premise-based to a more service-based legislation through the HACSA, first enacted amidst the thick of COVID-19 pandemic in Jan 2020. I would like to ask how these new sections will be judiciously administered with a balance between safeguarding patient safety and not stifling the development of new and innovative healthcare services that can benefit Singaporeans. Furthermore, under Clause 15, power is provided that regulatory action may be taken if a licensee contravenes or fails to comply with any condition or requirement relating to any approved permanent premises, approved conveyance, approved service delivery mode, or approved specified services. My question again is, how can this clause be judiciously administered in an environment where provision of healthcare services is becoming more complex and diverse? Well, with the Healthy SG implementation and a stepping up on preventive health, will there be grey areas that will be more debatable, and will placing the approvals on such broad areas on one senior public servant, the Director General of Health, be placing too much onus and burden on one authority? I know that Clause 23 allows appeals to the Minister. I would like to ask at which point might an advisory panel or sort, if any, be also involved for appeal cases. One of my personal observations for Singapore's success in riding through and managing COVID-19 pandemic so well is that we have a panel of highly qualified and respected healthcare experts with the humility to consult both local and global healthcare experts and use data and evidence to make recommendations and decisions with our political leaders. I wonder if the Ministry of Health should be more explicit in the amendment bill to provide rooms for having such an advisory panel comprising highly qualified medical and non-medical experts, including researchers, experienced and public-spirited health tech experts, and even community leaders who are committed to the best health interests of Singaporeans to present more comprehensive inputs in approvals covered by these new sections. This is to avoid precluding new or seemingly unconventional healthcare services or service delivery mode that may actually yield better health outcomes at more affordable costs to Singaporeans without comprehensively assessing them first from more angles. The next clarification is on the advertisement of non-licensable healthcare services under the Act. The new Section 31A prohibits the advertisement of any skill or service relating to the treatment of any ailment, disease or condition, etc., affecting the human body such that it induces a person to seek the advice of or treatment from the advertiser or the person being advertised. However, this prohibition does not apply in relation to an advertisement of a licensable healthcare service by a licensee or a person acting on the authority of a licensee. But the intent of the amendment is clear to me in protecting the public from being misinformed or misled by unethical parties. The letters leave room for ambiguity. Will the section unintentionally deter building of awareness of new service delivery mode, attempting to provide a more integrated health and psychosocial intervention to help those with chronic conditions and more complex illnesses like mental illnesses, which require biomedicine to treat? I'd like to ask, for example, if a well-trained counselor who is working within the physical premises or virtual mode of a licensee be able to share about what they can provide for mental health management? How about a TCM practitioner that has a partnership with a licensee like a GP clinic? Can the TCM publicize its services with the GP clinic? Mr. Speaker, I would like to conclude by thanking the officers in the Ministry of Health for working so hard over the past few years during COVID-19 pandemic and continually doing so in our efforts towards a healthier population against our fast-aging society. Future-proofing our healthcare system and protecting our public and patients are of paramount priorities. A duty of care and doing no harm should be a guiding ethic and principle not just for doctors, but for all players, including integrated plan insurers, third-party administrators, and online search engine optimization platform providers that want to contribute a part in managing one of the greatest wealth of all mankind, our health. Mr. Speaker, notwithstanding the clarification that I've raised, I support the bill. Thank you.